In 1531, tobacco was cultivated for the first time. After almost 200 years, it became an industry as people began to smoke and chew it. Because the men would bring cigarettes home from Europe during the First World War, they became overwhelmingly popular. 3,200 miners smoked their first cigarette each day. The number of young tobacco users is only going to add to the already 42.1 million adults. Every year, tobacco products take over 480,000 lives.
In 1963, the first CVS was opened in Lowell, Massachusetts. CVS is an acronym for Consumer Value Stores, which shows their desire to meet the needs of their customers.
In February of 2014, CVS announced that they would no longer be selling tobacco products starting in October. However, the company started their initiative a full 3 weeks early. The company wants to shift their focus toward the health of the consumers, even if it means a $2 billion decline in their annual profits.
I lost my grandma due to emphysema as a result of smoking for many years of her life.
One in every 5 deaths are a result of tobacco use, whether it be lung, mouth, or throat cancer, emphysema, heart disease, or diabetes. On average, smokers die 14 years earlier than non-smokers.
Although the listed diseases are better known, there are countless numbers of other diseases caused by the use of tobacco products.
I started having trouble walking, and I thought I had pulled a muscle, but I went to the doctor and they told me that I had blood clots. And from the blood clots, it led me to another doctor, which diagnosed me with Berger's disease. I've been like this for almost 17 years, and I still have to be very careful on what I do because today or tomorrow, I could bump into something and lose another finger. It's a terrible disease, it's a very painful disease, and it's an ongoing disease. My first 3 or 4 years were just, unbearable. I wasn't living. I was just existing. You say to yourself, you want this pain or you want your leg? You want this pain or you want your finger? At that point, it's like, cut whatever you want to cut. Just stop this pain. It's just too much. We have choices, and I chose to smoke. But if I would have had the information I think that we have today, my choice would have been much different. Just think of waking up one morning and all of a sudden your leg is gone.
Regardless as to which of the 100 types of cancers a person gets, abnormal cells are produced that end up taking over other types of tissues. Smoking causes many, many cancers that include the following, but are not limited to: mouth, nose, throat, esophagus, lungs, stomach, as well as the colon and even the rectum.
According to the Center for Disease Control and Prevention's website, within 5 years of stopping the use of tobacco products, your chance of getting mouth, throat, esophagus, and bladder cancer is cut completely in half. After 10 years, the chance of lung cancer also decreases by 50%. The website states that if nobody used these products, 1 out of every 3 cancer deaths in the United States would not happen.
Smoking caused my lung cancer. I was on chemo and radiation. They took part of my lung out, and they put this in me to drain the fluid.
Heart disease is another leading cause of death in the United States. Like many cancers, tobacco also causes heart disease. Unknown to the public, tobacco-related heart disease takes more lives than any other heart defect. 30% of the cases of heart disease are preventable by staying away from tobacco products.
My name is Roosevelt. I always thought that cigarette smoking just messed up your lungs. I never thought that at only 45 would give me a heart attack. I never thought that it would stop me from playing basketball with my kids. Never thought that it would give me a scar like this. And I never thought that it would change my life forever.
As nobody wants to live their life in agony, CVS Health is implementing their Start to Stop cessation program in hopes to prevent more diseases and deaths.
CVS Health is going to evaluate and support the members of the cessation program. Escaping addiction is a difficult thing, yet the company hopes that the program will be a support system that can end the suffering of thousands of people from their need for tobacco.
As CVS is one of many chains of convenience stores and pharmacies, they hope to influence other places to follow their lead. In 1996, Target banned their sales of tobacco, and other similar markets did not follow.
I think it's great that CVS is stopping the selling of tobacco products. Even though people can buy tobacco products from elsewhere, it's just showing that, hey, we're taking a stand against these things that can cause cancer and other things like that can kill people.
Although many people support CVS Health, there are others that do not.
RJ Falconer of Iowa says that because a lot of CVS's usually have the cheapest cigarettes, a lot of people are going to be upset. CVS took the products off of their shelves in hopes that people would stop buying them completely. Falconer's statement is relevant because people addicted to these products will still need them, regardless if CVS is selling them or not. These people will now be spending more money on their addiction since they have to go elsewhere, and they physically cannot help it.
The day of my surgery, I can remember smoking up to the front door of the hospital. That's how addicted I was. And I didn't know that I was so addicted until after I got out of the hospital. When I went home, I went straight.
Nicotine is a toxic, yellowish, oily liquid that acts as a stimulant in small doses. It is an extremely addictive constituent of tobacco. As nicotine is in all tobacco products, the companies that produce the tobacco use this property to their advantage. The nicotine rushes to your brain, which then releases adrenaline, which is why the substance gives you a buzz. After the buzz ends, you need it back. This up and down pattern is the reason it is so easy to fall deep into addiction. Many people become so addicted that they do not want to terminate their habits.
Other people who are not facing addiction are still opposed to the new face of CVS. USA Today published an online article that included the opinion of the founder of Citizens Lobbying Against Smoker Harassment, or CLASH, Audrey Silk's opinion.
In this article, she makes her feelings known. She labels this initiative as a perception war, outraged that they are engaging in public coercion by not selling cigarettes, when, in her opinion, junk food or alcohol are equally as unhealthy as well as legal.
I don't think it's hypocritical because junk food doesn't kill people as much as tobacco does. Alcohol doesn't kill as much people as tobacco does. I think it was a good thing what they did.
I think it is hypocritical because you're taking away people's right to buy what they want to buy and take part in what they want to take part in. So if there's something that I want to do, like if I wanted to drink alcohol, I can buy that there, but I can't get tobacco there. It just doesn't make a lot of sense because it's the same basic idea. You're just taking away someone's rights.
19.6% of tobacco sales come from convenience stores and pharmacies. In North Carolina, the largest producer of tobacco in the U.S., there are 250,000 jobs in the industry. In an article from newsobserver.com, Tommy Bunn of Raleigh, owner of a tobacco company, says that the recent changes at CVS could cause an impact if it were to become a national trend.
CVS will be the first major national retail chain to drop tobacco products since Target did it in 1996, according to the Los Angeles Times. But unless tobacco companies' opponents are able to use CVS's move as a leverage to persuade other major retailers, such as Walmart and Walgreens, the tobacco industry will not be dramatically affected.
You can see there are multiple arguments to this new face of CVS.
It's beneficial to everyone that CVS stops selling tobacco products in an attempt to help people break their bad habits and quit. CVS Health's Start to Stop Cessation program is in place to help people who would be coming to the stores to buy the tobacco products wean themselves away from the harmful effects altogether. CVS.com states, studies show that smokers assisted by a healthcare provider have a greater chance of quitting smoking. The program includes individual plans and consulting, nicotine replacement recommendations, and continuous coaching and support.
Hopefully with this program in place, along with their stopping of sales, CVS Health can make a large impact on one of the world's most deadly habits. Having both lost family members to diseases resulting from the use of tobacco products, it is our stance that this new chapter of CVS stores is extremely beneficial and is doing a global service.